Please read and oh, okay. We've started the recording. Fantastic. I've got the transcript going, which is good. So welcome everybody to September's Drone Research for Advancing Community Healthcare and Medicines Access meeting, or the DRACHMA network. And we've got a couple of fantastic presenters. We've got Tautvydas and Ivan, and I'm going to leave them to introduce themselves because they've got some great insights and great experiences in the world of drones. So without further ado, I'm going to stop sharing my screen, and hopefully, Tautvydas, you can share yours. Brilliant. Just before you start, Tautvydas, as always, I'm just thinking about some new members of the group. If you've got any questions, please use the meeting chat facility, write them down. If we've only got one or two questions, I'll ask you to re-ask them to the presenter, so 5 minutes at the end of their presentation. If we have a lot of questions, then I'll try and pick one or two of the selected ones. And of course, other members of the audience, with the thumbs up sign, you can vote on the question. So I would encourage other members of the audience, if you think that's a good question, give it a thumbs up, and then I would home in on that question if we've got more than enough to fill the space. So I'm admitting Astrid. And so, Tautvydas, I think the floor is yours. So please begin.
Great. Thank you very much, Paul. And just to clarify, I have 20 minutes, right?
Yep. Yes, please.
Great. Thank you very much. Good starting my clock. So, hi, everyone again. My name is Tautvydas. My full name is much more complicated, but I'll not get into that detail. I work with UNICEF at their Supply Division, which is the headquarters for supply, logistics, transportation, and procurement. So, and probably a lot of you know what UNICEF is. UNICEF is one of the UN agencies that is responsible for really supporting education, health, child protection, social security programs to really ensure that every child on planet Earth can really survive, but also thrive. So we work in over 90 countries globally where we support a range of different programs. And in order to effectively deliver our programs, our supply division really focuses on the procurement, supply chain, and transportation part of it, because we are one of the largest procurer of vaccines in the world, and we have been very actively involved in also COVID-19 response. So, and naturally, we are constantly seeking to innovate the way we deliver on our programs, we deliver to every child. And drones naturally is one of the tools in our toolbox that we aim to utilize in that regard. So just, speaking about the need, it's really 1 billion people that lives further than 2 kilometers away from an all-season road. And that is even more dire in sub-Saharan Africa, where 29% of population live more than 2-hour travel from a nearest public hospital. And that really suggests that local health centers play an extremely important role in saving lives and ensuring the strengthening of the health systems. And of course, 10.6 million children do not receive first dose of basic vaccines, and most of them live in remote locations. And as you can see, distance, and some researchers suggest that the bigger the distance to health facility, the lower the health service utilization and higher neonatal mortality. And overall, lack of accessibility and poor transportation often leads to lack of equitable access to health and other essential services, including health commodities. And as you can see in these pictures, our partners and our staff in various countries really struggle to get to that last mile to reach those children and communities that live in far or remote areas that often are disconnected by poor road infrastructure, topographical challenges, or weather-induced challenges, and it really takes a lot of effort to reach. And because of this, we started back in 2016 thinking about the use of this new innovative technology to deliver medicines, vaccines, diagnostic samples, and other medical supplies to those remote health facilities. And we have recently conducted a country office survey, because we really have a huge network of country offices all across the world that can really advise us on what are the last mile delivery challenges. And you can see, we asked them, how often is transport the leading cause of last mile delivery challenges? Because there might be multiple different reasons why people are not receiving medicines, right? So root cause analysis is very important. And as you can see, a lot of countries indicated that it's either usually or sometimes the leading cause. And quite a few countries, countries indicated that transport is the leading cause always of last mile delivery challenges. So that kind of gives us a better sense on where really to focus our efforts in strengthening government's capacity to integrate this technology. It is also important to note that UNICEF often, or most of our work really finishes at the port of entry, where we deliver medical supplies when it comes to regular in-country logistics. Of course, for emergency logistics, we have a lot of partnerships, and we deliver ourselves much needed supplies in emergency contexts. But governments play a central and very, very important role in integrating new modalities of transport in the existing logistics networks. And that's why UNICEF is often a technical partner who provides a technical leadership and support to the governments in conceptualizing and bringing these innovations to reality. So now, what are the benefits from several country projects that we have implemented? And from the projects that some of our partners have implemented. Of course, we use drones mainly in Malawi and Vanuatu to date for short-term projects. We've seen that drones helped us reduce the turnaround times of diagnostic samples. We saw that it also increased the sample collection by 130%. We also saw the reduction of delivery time from what it would normally take 1 to 2 days to really 30 to 60 minutes. We saw that it could also help improve compliance and adherence with immunization and treatment schedules. Now, people who come to the health centers, they actually can realistically expect that vaccines will be available, or even if they are not available, the health center could actually ask drone to deliver vaccines on demand. We also helped introduce services that wouldn't be available otherwise, such as diagnostic services. It also helped minimize stockout levels of vaccines and other health commodities. It helped increase general availability of health commodities at the health facility, and also reduced health facility dependency on storage capacity and storage equipment. If we can have drone that can deliver commodities on demand, we really reduce that dependency on storage, which oftentimes includes cold chain storage. Now, even if we saw the huge potential, even if we see the huge potential, is oftentimes it's quite challenging to scale innovations like drones. And I was participating in the previous presentation by Gabriela from UpDoc, and I really advise you to also to join UpDoc Network, which is a great, extremely great resource for the experts in our field. And what UpDoc has done in cooperation with Interagency Supply Chain Group that I also coordinate is they created a medical drone delivery database that houses many different information about different drone delivery pilots. And I just wanted to kind of to showcase the challenge of scaling innovations is that a lot of projects really focused on testing the feasibility and testing the technology. And if you can look into the database and you can even download the full data set from the database, you could see that only 3 projects lasted longer than 12 months. Which means that a lot of projects really focused on testing that feasibility and technology. And And you can see the phase 3 projects. It's only a couple of projects that really are scaling the use of drones. And namely, this is Rwanda and Ghana projects implemented by Zipline. So that being said, a lot of that activity was really short term. That was limited in duration, also limited in funding. From our perspective, the way we see it, and some of the reasons why it didn't manage to scale is majority of drone projects focused on technology proofs of concepts as opposed to value and impact. So a lot of them really measured, whether technology can be successful, as opposed to they really didn't look comprehensively due to obvious reasons, lack of funding, lack of time. They didn't focus on the business and sustainable financing models, as well as limited resources were allocated to the design of the activity. How drones get integrated as not a standalone activity as a part of supply chain, but how it gets integrated into the system. The way we could see the ideal scenario for drone integration is that it really needs to fill in all of 3 boxes to really provide an impactful service to the in-country logistics or health supply chain. Of course, technology needs to work, but besides the technology, there needs to be business case where the customers are willing to pay that price that is offered for that particular service, or at least there is a base of customers that can afford this. It also needs to be driven by a clear demand and need in country. It needs to consider the root causes of the supply chain challenges to understand whether drones really fit. Maybe the problem is that procurement doesn't work and actually medical commodities do not get to the country. Maybe the challenge of logistics in country is that there is a lack of overall financing of public health supply chain. So we could say that the ideal scenario should really consider multiple different aspects. And, we have, with this experience in this area, we started kind of conceptualizing on how we can actually avoid those common mistakes of scaling innovation and actually failing to scale innovation. And we looked at how we can actually provide support to our country offices that are very close to the governments on the ground to help them conceptualize the drone delivery and help them integrate drones into the existing supply chains. So we have, as I mentioned before, we have been engaged in several countries to date. We've had a lot of experience in Malawi as well as Vanuatu. Vanuatu's drone trial was the first in the world to deliver vaccines by drone. But really, what we are doing, and as a part of my work, what we are doing at Supply Division is we are providing tools, resources, a knowledge hub, so to speak, to the country offices who can actually really deploy those tools and resources on the ground to help governments integrate drones into supply chain. And the way we see it really consists of 3 different elements. Firstly, identifying the need. The third one is building an enabling environment that consists of multiple different elements. And the third one is really choosing the right solution for the right problem. And I'll quickly go through these, but also we'll share the presentation afterwards. So in order to identify the need, we really utilize system design approach, which serves as a blueprint for how supply chain should run and how all these components of supply chain system fit together to interact and improve health outcomes. So drones is just a tiny piece of the entire ecosystem, right? Entire health supply chain system. But we really need to take those system design lenses to understand how it really fits and interacts with the others. And in order to do so, it's really a multifaceted process in consulting different stakeholders, in analyzing the needs, analyzing the demand, and also phased implementation, which allows us to trial and error the use of drones as a part of the entire system. Why is it needed? You can see a very interesting visualization on how public health supply chain in the country functions. And you can see it's a very, very complex mechanism, and that's an example from Kenya. I know it's quite outdated, but I haven't checked with some experts, not there were no major kind of changes, and it's really shows that the government plays a central role in distributing those health commodities. But it is very important to understand the complexities within the health supply chain, and system design is a very good and useful tool in understanding those complexities to see where drones, or maybe drones could even cut across different elements of that system to help support multiple different programs. So in problem space and identifying the need, we really need to look at geographical, physical constraints, healthcare system and health indicators, supply chain system analysis and transport network assessment, as well as emergency nature and dynamics, to really be able to understand and answer the question, can drones help solve an actual logistics problem in a specific context? For that purpose, for that analysis, there is very interesting white paper that has been developed by JSI that speaks about 3 pillars of that analysis. Should we deliver health commodities using drones? And that builds on 3 key pillars, which is geography and transport networks, product and service demand, and UAV characteristics. And these 3 pillars are then compared against logistics and supply chain performance objectives, because ultimately what we want to see is that drones really add to the bottom line, that the drones improve supply chain performance, which subsequently leads to health outcomes. Also, there is a couple of studies that speak about how what are the drivers for cost savings of drone delivery, and maximizing number of flights, large number of facilities, increased range and speed of drones, also comparative speed of alternative transport modes. But most importantly, what is often missing is understanding that drones can be multi-purpose vehicles, that drones are not only suited for one specific application, but they can also be used all across different health commodity groups, but also across different use cases, such as mapping or connectivity. And that multi-purpose potential of drones can really increase the cost savings, and the capital costs could be distributed among different clients or users. So that was kind of identifying the need and understanding where really drones fit. Now, enabling environment is another very important aspect, because obviously without regulations, local skills, without social or political acceptance, we cannot make it work. And UNICEF has done a lot of work in this area, particularly in Malawi, where we have established humanitarian drone testing corridor. And I myself was working in Malawi for 1 year, where I was administrating the drone corridor. And drone corridor really served the central piece of enabling environment. It helped us create interim drone regulations that permitted, with the rigorous process, permitted BVLOS flights for drone deliveries. It was a regulatory sandbox to test out what works and what not. It was extremely useful to test out different methodologies of community sensitization, and we really heavily actively engaged with the local communities, as well as it helped build regulatory capacity of the Department of Civil Aviation. And that served kind of a big regulatory sandbox that allow us to enable high-frequency drone operations in Malawi. Just as an example, there is currently 2 ongoing drone delivery operations in country that are happening in the central and the southern region that are delivering medical commodities daily. Another very important aspect of enabling environment is, of course, building ownership for sustainability. An example of African Drone and Data Academy. The academy was founded and established by my colleagues in Malawi, and it's a very successful program that provides education in drones for local youth in Africa. And it's really a program that enables local students to get those skills and really immediately apply those skills on the ground, given that there is plenty of different projects in country. You can see some of the results, but I'll be sharing this. I think one of the key highlights is that 90% of the graduates from the first cohort immediately found employment in the sector, and they have been deployed to mapping, delivery, or even other projects, and have been working in private sector as well as the governmental sector. Finally, choosing the right solution, and I'll be really quick. I think drone technology is becoming less and less of a problem or a challenge, because there is a lot of capable drone platforms on the market. And of course, we are mainly focusing on that kind of small package delivery segment, but there is also a big increase in platforms that offer large payload capacity. I think for us, a couple of considerations: should governments outsource or insource drone delivery? And obviously, we think that a lot of efficiencies could be gained by outsourcing this, but the government needs to build the capacity in managing the contracts and procuring drone delivery services. And we have been providing technical support for several countries to really procure drone delivery services. We have sample terms of reference. We have other documentation that really helps governments go through the entire procurement process, and this is kind of our bread and butter in this area. So in wrapping this up, I've spoken about the challenges, the needs, potential benefits of drone delivery, and how we are trying to conceptualize the use of drones internally at UNICEF. But what do we really do to make it work, right? So we are really working on building a drones knowledge hub for our country offices to support them with very easy to use tools and resources, so that they can help governments and partners integrate drones into supply chains locally. And we are working with several countries, including Sierra Leone, Namibia, and Liberia, in supporting them in this, conceptualizing, building roadmaps, and also building investment cases, because it's very resource-intensive process. As well as we are doing donor coordination. The group that I mentioned before, it's an interagency supply chain group, UAS coordinating body, which has 14 international organizations and donors active in health supply chain space, to really align and coordinate UAS investments in this area. And we meet on a monthly basis like you do, and we really discuss different projects and seek for synergies where multiple different donors can come together. So I would like to stop there, and really happy to answer any questions you might have. Thank you very much.
Tautvydas, that was fantastic. We've got a few minutes of questions. The good news is that we were gaining people as you talked, so that was good. So we had lots of people entering the meeting as you were talking away, and I think we're just concentrating on the messages there. Is there any questions from the audience? Anything that's come up? I've got one. I was of course I'm an academic, so I was quite intrigued by your academy. Is that something that's accredited by local teaching organizations? Is it a degree level thing? Is it sort of a baccalaureate type thing? Could you just give us a little bit more about that, because that seemed very interesting to me.
Yeah, absolutely. So in terms of drone licenses, it has an AVUSI approval for an international drone license. But this is a specific track that you need to fulfill for. It is outside the generic course that takes 3 months. Yep. So usually in order to get a USI certificate, I'm not sure. I need to double check how long it takes. So that's it. The plan, even though it's like a 3-month course, that it's outside the general university courses, but has strong affiliation with Malawi University of Science and Technology. The aspiration is to build a master degree program in innovations that really a drone is a central piece of it. And the colleagues are working towards that to really get it accredited. At the same time, the key leading partner in this program is Virginia Tech, and they basically are applying the same or very similar curriculum in terms of the drone design and communications of drone, aerospace engineering, really making that course, really compact and transferring this into the ADDA curriculum. Yeah.
Very good, very good. So it sounds as though it's equipping students to fly drones safely, but also to develop the technology as well. What about sort of the user cases and that kind of thing? Some of the lovely stuff that you've spoken about in that kind of, is that incorporated in some of those courses?
Exactly. So actually, drone delivery and drone mapping are the two core applications that students are looking into. And of course, drone mapping even has a separate module within the program where they have, I guess, 3 or 4 weeks with GIS experts to really collect the data and analyze the data and really process it in the classroom. Another module is really safe operations, and that's probably more closer and very relevant, of course, for drone delivery because we need to consider BVLOS flights. So they are taught about how to build a drone, and they build a drone themselves, very low cost phone-based drone, fixed wing. Yeah, exactly. It's very fascinating. And they really test it, they design it, they work on communications, control and command link, and of course they also discuss, airspace safety topics, drone regulations, how to make it safe, what is a safe drone operation.
Good. And any other questions from the audience? I'm monopolizing Tortoise here. I feel a bit guilty.
That's completely fine.
Well, oh, here we go. Annalise. Annalise, would you like to unmute yourself and ask your question? Brilliant.
Yeah, sure. Good morning. And thank you very much. It's very interesting. And, actually, I think it's a great program. And definitely, if there is a place where drones and UAS can be valuable, that's in the areas that you mentioned. I was just wondering, if we can be of any help of some sort, can we contribute or not really because we are not in the right place? Do you, I'm sure there would be a number of people around the meeting today who would be happy to contribute in one way or another, whether it's through expertise, information, etc. Can we be of any help, or let us know?
Oh, most definitely. Thanks, Annalise, for this kind offer. And just to make sure I understand correctly, which organization are you coming from? And just to understand the background where you're coming from.
Sure. So the organization is the Drone Office, and as mentioned in the name, it's relatively specialized. Focusing really on drone operations, and we're involved in a couple of medical drone delivery projects here in the UK, funded by Innovate UK. So with some, broad knowledge on drone operations. Now, clearly, not having any links to the countries that you mentioned, but I think in terms of knowledge, expertise, if there is a need for help, I think it could be an option. But you clearly mentioned the obstacles to scaling up, and not so sure if let us know basically if there would be something we could support you with.
Great. That's great. And I'll drop my email, so feel free to drop me a message, and we can schedule a follow-up call so that I can also understand what are your lessons learned. And it's extremely useful. I've been following a little bit of those pilots in the UK, and it's always very useful to understand what's happening on the ground and share lessons learned and experience and expertise. Thanks a lot for that.
I've got an eye on the clock because we've got Ivan that's ready to speak. I think one of the questions that bobbed up in my mind was the Malawi air corridor. That'd be a great place to test technologies that we're developing, kind of thing, over there. So, but that's probably another conversation kind of thing to have. So Tortoise, thank you very much for that. That was a very, very good talk and very, very interesting. And hopefully there's a nice conversation between you and the drone office that's going to develop. I
Wonderful.
can see.
Thank you so much for the opportunity.
Thank you, Tortoise. So I've got Ivan waiting in the background. So Ivan, the floor is yours.
Thank you very much, Paul. Let me share my screen. Can you see that?
Yep, that looks fantastic.
Perfect. So I would probably start with a brief introduction. My name is Petrunin, and I'm lecturer at Cranfield University, and I'm working at our new, exciting, beautiful Digital Aviation Research and Technology Center, which was opened officially just a couple of months ago, mid of July. So what I was going to talk about today is about safety of UAS operations, especially in urban settings. Here in this presentation, in this conversation, I would like to refer to findings from our project, which is called AiResponse, where we were focusing on aspects of enabling inter-site medical deliveries, specifically discussing logistical and operational challenges presented by, in particular, COVID environment, current COVID environment. And I will introduce the project a little bit later. All right. So, brief introduction. We obviously seen huge rise in applications of unmanned aerial systems, and in particular small ones. So obviously there are different segments of the unmanned systems which are being developed. Small systems are being important as well. And in particular, the quick development is happening for applications in urban environments. There are multiple use cases which are considered promising and being developed at the moment. Obviously, commercial package delivery, which starts to happen in many places. Inspection of critical infrastructures, and there are multiple examples, such as inspection of buildings, power lines, airports. Application for precision agriculture is probably state of art today for farming, for example. Search and rescue operations are quite important as well. And of course, medical deliveries, which is a topic of the meeting today. The challenges which we face during the missions, as discussed, is mostly about ensuring safety of these operations. And a particular complexity here is brought into consideration by urban environments, where we have complex setting, including multiple and heterogeneous obstacles, issues related to signal propagation, which is effectively degrading quality of the communication and navigation due to reflection and multipath problems in urban environments. A little bit generalizing, these issues can be observed in other environments, specifically when we speak about forest environments or mountains. The same problems can be experienced in these settings as well. So findings of this particular project are actually applicable to multiple cases. And of course, operation of unmanned systems needs to be reliable, because the failure could lead to potentially loss of life and obviously damage to property, damage to environment. And therefore, safety-related risks and related mitigations are of particular interest for enabling operations in organized manner with respect to present infrastructure in urban system, and also monitoring of airspace, because obviously airspace is being shared by multiple users. Therefore, monitoring and proper arrangement of operations is of high importance. And I would like to start with an example, which is probably not something what we would like to see during the drone operations, but this is something what happens. And this is relatively recent examples of the drone crash which happened in UK in December 2019. So this has happened during the routine survey operation when something happened with the onboard avionics of the drone, and it was relatively large survey drone of almost 13 kilos total weight, which has lost navigation capabilities, and because of that entered the dedicated safety mode. But because of the environmental conditions, and it was particularly windy on that day, it wasn't able to maintain position, because without GNSS, it was not very effective. The navigation system was effectively disabled. And due to some delays from the pilots, which were not able to react quickly enough, and it was a matter of tens of seconds actually, where the situation was obviously very dynamically evolving. The drone was blown by wind and it was gradually decreasing altitude, and finally it has crashed into the property. Luckily, no one was affected, so it was no casualties here, and it was only some damage to the property and obviously crashed drone. It is interesting to know that the drone, which was in operation, has triple redundant navigation system. So the redundancy needs to be taken into consideration, specifically in the aspect how this redundancy is enabled. And recalling now the project which I was mentioning at the beginning, the project is funded by Innovate UK. Again, this is project focusing on enabling UK intersite medical deliveries, specifically addressing logistical and operational challenges presented by COVID environment. And in this project, we have a number of partners, including present here Paul from King's College and Annalise from the drone office. Other partners are Intelsius, which is a provider of medical packaging, which is used for these deliveries. Hirotech 8, which is the company developing drone-in-the-box solution, which is quite beneficial for such operations. Blue Bear Systems Research, one of the drone operators companies, and Cranfield University. So what the project is about, it is aiming to create a set of standard operational procedures, demonstrate usage on site and between the sites, drones delivering medical supplies with automatic takeoff and landing, perform investigation of safety aspects through simulation related to airspace management and specifically collision avoidance and detect and avoid capabilities, navigation and communication risks in order to support development of the safety cases. And the part of the project, as an important part of the project, we are aiming to raise awareness as well of benefits brought by drone operations within the medical and healthcare communities. In this presentation, obviously, I cannot cover all the findings from the project, and if we'll have some questions, maybe Annalise will help a little bit with the description of procedures which we have developed. But here I would like more focus on safety aspects of operations, and this will be based on findings from our simulation activities. So I would like to start with detect and avoid capabilities, which are considered as one of the enabling and most critical capabilities related to drone operations. Why detect and avoid capabilities are important? Because they define awareness. Even in case of remotely piloted drone, they define awareness of the drone operator about safety risks in the airspace around the drone, such as other airspace users being other unmanned systems, aircrafts, helicopters, balloons, birds, and also static objects which are present in large numbers in urban environments, and not only in urban environments, such as buildings, foliage, wires, which need to be avoided during the operation. We are not speaking here really about autonomous operations, so the importance of detect and avoid will grow manifold, many times if we speak about autonomous operations, but even for remotely piloted operations, it is of extreme importance. And for these operations, we were developing risk assessment procedures. Obviously, this is done in simulated environment in order to enable realistic assessment of the risks. We have conducted development of three-dimensional environments, realistic environments, which are taken for particular use cases. In our project, the use cases were related to delivery of small medical supplies, such as test kits, for example, or samples by drone, and based on Milton Keynes University Hospital environment, and also at Cranfield, where we have obviously test center for lateral flow testing of students and staff, and delivery of test samples is of significant interest to be performed by drones without exposing people to additional risks of viral contamination. So the proposition which we had made in this project is to assess hazards imposed by obstacles according to the not only proximity to these obstacles, but also the dimensions and type of the obstacle. And the findings, the results we have derived from the project show that using the metric, which is based on combination of distance to the obstacle, type of the obstacle, and dimensions of the obstacle, allows to generate recommendation to the drone pilot. For example, remain staying clear, or perform emergency landing in case of high values of that metric. We have tested collision avoidance using simulation. So in addition to realistic environment, we have also developed sensing capabilities, utilizing drone model, utilizing sensor models such as monocular camera and LiDAR. And we performed the simulation, finding that it is possible to develop strategy which will allow increased situational awareness of the pilot and allow implementation of the collision avoidance algorithm on board of the drone. Other two parts of our study were related also to investigation of communication and navigation risks. And as I was presenting in the example, navigation is quite important, specifically for urban environments when we have multiple problems related to obscuration of the satellites, and obviously GNSS is one of the most common means of the navigation for drones. Problems with the signal propagation from satellites due to obscuration, due to multipath, and also interferences. In the above example, the interference coming from one of the power plants was causing problem in the navigation system because it has affected magnetometer measurements. So understanding of these problems is of high importance, and this is what we integrated in the simulation environment as well. So using our simulation synthetic environment, we have modeled propagation of the signals from the antenna for a remote drone operator, And we have also modeled propagation of the satellite signals. So what we have found is the map and quality of service for the signals which are being utilized for communication with the drone. And again, this is of utmost importance because drone operator receives all information about the drone through communication channel and also navigation system, because we need to have a reliable information about where the drone is. It is not always possible to see everything from the camera only. Therefore, navigation information is very important. So it will define how well drone is able to follow its dedicated route and complete mission successfully. So what we have concluded in the discussion with the partners in the project, a number of important issues which needs to be considered for practical application of the small aircraft systems for operations in urban environments. Navigation accuracy is one of the very important aspects, where in particular ability of the drone to avoid collision is highly affected by the accuracy of the state information. So if we know where the drone is, it might be able to support operator, and this becomes more important if it is autonomous operation, in finding the best possible collision avoidance maneuver. Obviously, there are problems here related to urban environments, which degrades navigation or the quality of navigation signals. In terms of detecting obstacles, noise and bias of sensors is also of high importance. So we would like the drone to be with open eyes and being able to see all the obstacles. Here, and I will refer to this later, weather is quite important, as well as accurate analysis of the sensor models. Computational delay, which is frequently not included into attention, is another important aspect. So in order to remain well clear, especially when we speak about delivery operations, when drone is moving with significant speed, computational delay should be small in order to allow for decision making. And the requirements to capability of the drone to see well ahead will be supported by computational delays of the system and also capabilities of the sensors. Weather effects, in addition to the obscuration and degradation of the sensory information from the drone, weather obviously will directly affect operations of small aircraft systems, such as wind, for example, or heavy rain. This may increase the problems in the control system and prevent actually safe drone operations. And finally, communication issues, which is one of the most critical problems, as I mentioned, especially when we speak about deliveries at a long distances where line of sight is not possible, where we cannot place all the antennas along the drone route. We need to understand the quality of the signals along the whole path of the drone. Interruption in the data link for the drone will lead to loss of detect and avoid capabilities, because operator will not be able to react appropriately if it is remotely piloted drone. It will prevent obtaining sufficient information which can be supplied by external sources, for example, about map of the environment, about updates in airspace on airspace users, and so on. Therefore, communication is a very important aspect here as well. And finally, so how this information can be utilized. So, okay, we understand problems related to collision avoidance, and we understand all the parameters of the drone related to collision avoidance. We know quality of GNSS and communication system. So how do we use that information? This can be directly used for planning the mission. So we can avoid routes which are having excessive problems with, for example, GNSS, with potential interferences and communication signals. We can also support development of the smart systems on board avionics for the drones, which will be able to predict these problems and being able to mitigate them with additional sensors, for example, or utilizing external information. And these works are being done. In particular, we are also working on these approaches at Cranfield. And finally, our developments in the project, which include obviously procedures, which include development of the applications, integrating routines at hospitals for handling deliveries, and also management of packets during the flight. This information was supporting analysis of perception from medical professionals on drone operations. And what we've got in this analysis, from this analysis, is that we have mostly positive responses on perspectives and on perspectives of use of drone deliveries for medical purposes. So you can see some examples of the quotes which we obtained from high-level medical staff at hospitals, for example, which are very supportive for the increased use of drones, which will help to address a number of challenges in healthcare, in particular delivery of critical supplies at a quick, at a short time when they're really required, and also they may help addressing problems of deliveries into very difficult places. And difficulty here can be related to the environment itself, so it can be hard to reach, for example, due to particular road conditions, or it can be a problem related to viral contamination, which was, again, a subject of this project. So this is it. Thank you very much. And if there are any questions, I'm more than happy to answer.
Fantastic. Thank you very much, Ivan. So the floor's open. You brought it back into time as well, so thank you for that. So we've got a couple of minutes for questions. Anything from the floor that comes to mind? I've got a devilish question from somebody who's a bit naive in this particular area. If nobody else wants to go forward at this stage, what's the role of artificial intelligence in these sort of simulations and drone operations in terms of urban environments? Could a drone sort of start to learn the safest routes if it's doing sort of regular trips and stuff like that? Is that possible?
Yes, it is not only possible, it is being actively developed. Okay. So in simulations, we obviously don't use much of artificial intelligence at the moment, but artificial intelligence is supporting all enabling technologies which are used for navigation, for communication, for collision avoidance, and also for path planning. So, okay. For example, having all multiple constraints which are related to presence of blind spots of navigation, comms, also related to time constraints, battery status, weather conditions, potential potential, effects, for example, wind gusts between the buildings, status of the packet itself, temperature and time limitations on the particular item. All of these can be fed in into the AI-based model in order to plan the optimal mission. And it can be not for a single delivery, but for example, for a chain of deliveries. So AI is very actively used in order to support this extremely complex optimization task. It is also supporting better performance and high resilience of navigation and communication, in particular when we need to switch between the sensors, what sensors needs to be used, and how to utilize information from multiple sensors in the best possible way. So these are all hot and trendy areas for the development using AI.
I've got another follow-on question, but is there anything from the floor that wants to? You mentioned weather, and I think in rural environments, weather is a little bit more easily predictable, because I know I'm in London right now, and micro environments and also the shielding and the vortexing of buildings as well. So are you thinking of, I mean, do you have to have lots of mini weather stations, or can you put some weather monitoring directly onto the drone to help some of those issues?
Well, there are ideas such as that. So, for example, when drone operations will be more widespread, it is possible to collect that information routinely from the drones which are flying around. And this can be used for more effective monitoring, for prediction purposes, and also for developments in the area of robust control for the drones. Because when the drone is flying between the buildings, for example, and when it enters the area where the wind blows, after the area where it is protected from the wind, for instance, and obviously at a height, it is much bigger problem than at the ground level, then stable control system is of very high importance. So significant attention is paid to controllability of the drones, especially in complex conditions.
Fantastic. I think Tautvydas has come in the chat. He's got a nice link to improving, I think, sort of prediction and measurement of weather there. So that's good. I'll look at that afterwards. I have got an eye on the clock. So if there's no burning issues from the floor, what I am going to do now is thank both of our speakers. Tremendous talks at both ends. I've got some claps there. That's a very good sign. Sort of attacking the issues from two different ends, but sort of coming together. It's all about safely delivering the medicine and the cargo accurately to the place where you want to do it. So really good solutions discussed there. So what I'm going to do now is I'm going to stop the recording.